the presentation. So my name's Debbie Armstrong and I'm the Deputy Director of Nursing at CMFT, and I'm joined by my colleague Steve Mosby from the Improving Quality team. So we're here to talk to you, so timely before lunch, about what we did at Central Manchester as part of our What Matters to Me patient experience programme and the Perfect Dining Week. I'm sure a lot of you will be aware of perfect weeks that have happened in a number of organisations, and they've tended to be around urgent care and patient flow. And as Deputy Director of Nursing for Quality, I suppose my ask of the team was, why couldn't we do this for a quality initiative? So where did we start? Patient experience feedback is a rich source of information, and nationally, when we looked at how our patients would rate hospital food, as you can see from those scores, and those scores are out of 10, CMFT wasn't where we really wanted it to be. And certainly what our patients were telling us locally, so this is some local patient experience feedback, was although we were seeing step changes and we were improving patients' dining experience with nutrition and hydration, that actually we still had a way to go. So we developed a Perfect Dining Week and we scheduled it for 7 days. So we ran it Monday to Sunday in July last year. The intention really of the week was twofold. It was to provide that perfect personalised dining experience to all our patients at every meal throughout the week, but also about what we could learn beyond that time and about developing long-term learning that help us in our continuous improvement journey. So just very briefly, what was absolutely key to the Perfect Dining Week was the engagement and the collaborative approach. We involved colleagues from our Estates and Facilities team, some of whom are here today, and our PFI partners, Sodexo, who are our food provider at the organisation. A massive amount of planning went into the week, lots of communication and briefings. We ran a command centre, as you would in any perfect week, and we did a massive amount of data capture, which Steve will explain a little bit more about in a second. We also challenged all our divisional and hospital teams to do activities during the week to provide that perfect dining experience for patients, and we did lots of displays in our atriums. These are just some of the divisional activities that happened during the week. Day room dining, that was one of our divisional directors helping giving meals out in the children's hospital. So what did we actually capture and what did we actually learn during the week?
Okay, so as an information manager, data is my world, and during any type of week like this you need to capture some information so you can see how we're doing and what we can do from there. We caught 4 main pieces of information at each meal time for the entire week, so that's 21 services. The first one was down to our colleagues in Sodexo. They let us know how many meals were ready in the kitchens to go up to the wards. We have a big central kitchen, everything gets sent all around the hospital. That part was there. We also had a process one, and we call this down to our quality standards. So every ward across the entire trust would have a quality audit and just have a look and see about their local process, whether everything was going to plan, everything was getting ready and sorted. We then also had the patient experience. We asked every area was asked to go round at each mealtime, find 5 people, and ask them a very short little survey about their current mealtime. So we're coming up to lunch right now, we're all getting hungry, and we'd be at the moment doing the process one. We'd be getting the food all ready for you to eat. And then just after you've eaten lunch this afternoon, someone on the team would go around from each ward and go and survey. We also had an extra survey for diet bay meals because they work in a slightly different way for some of our patients who have specialised diets. Now, in the command centre where you saw the picture earlier, we're on a different building at the other side of our hospital site, and we wanted everything to feed through as quick as possible. So locally, people would be filling out paper surveys and then head over to a computer and type in to online surveys, which would then feed through to, bear with us for this, a massive dashboard which came up on our wall. Now, if any of you like Eurovision, there's not many, it was like that because a lot of people were a bit, oh my God, what's this? When it was on the wall and it was all blank. But as soon as it started feeding in and different wards started reporting, everyone like, oh look, Ward 5, look, got information. It got everyone really engaged, and it was a great way to see across our trust how it was working. One thing with central Manchester is that most of our hospitals are based down the Oxford Road corridor. We also have a separate site over at Trafford General Hospital, which is 7.5 miles away. And we also have a private unit over at Gorton, which is provided by Bupa Healthcare. So we were getting all the information into here by division. This will tell us the process, how it's gone, whether the wards have got everything all ready and sorted, and also all the scores are all coming from the patients, from their actual details. So as it's going through, all this information is feeding through. This is the breakfast one for one of the first few days, and you can see there's plenty of green ticks there, so we've got most of the information in. By seeing this at breakfast as the information was coming in, we were able to have a meeting afterwards and go, right, we've had a problem with X, Y, Z, we need to fix this before the next meal service, if it's something along that way. And as for the ward audits, we could see, this is looking at one of the wards in general, whether the ward manager had said, yes, everything's absolutely fine, or if there is a problem or something which we need to be aware of in the command centre, so we could pick that up later on. With 21 meal times, we had a lot of information come through. 21,724 surveys from meals were delivered, of which we got nearly 6,000 pieces of patient feedback over that week, and loads of other audits. We did a baseline, we tested it the week before, just because, you know, not everything technology works all the time, and then we could see each day as it was getting better and what the scores were through that week. So it was quite an interesting week.
And long, let me just
Very
tell
long
you.
week.
I think, and I'm just conscious of time with the counter going down over there, but I think that there were two things for us. What the week's enabled us to do is provide wards with their own data to support them with that continuous improvement journey, with the bottom up, looking at where they did well, and where there are areas for improvement. So if they had an issue with protected meal times, that was something that they could work on. But also what we've managed to do is we've managed to identify 10 high impact changes that as an organisation we will support, one of which we undertook last week in Nutrition and Hydration Week, which was the relaunch of protected meal times, and we've got some general posters and some helpful information packs out on the stand if people want to come and have a look. So there was lots of things that we found. Cold toast, that was just a story in itself, let me tell you. But I think what was really good is that we had some really positive comments. Although we knew that our patient experience feedback generally required improvement for dining, we had some excellent feedback, and I won't go through this. I'm sure you'll get the presentation at the end. One of the things that we did though was a Change One Thing initiative, and we had these little cards produced that we handed out on the wards, and we just wanted to add, and we asked patients, whether that were children and young people in our children's hospital or across our adult services, what are the types of things, if you could change one thing about the meal you had. And remember, we were doing this in real time after every meal, so people were telling us in real time what their meal service was like. And so we got lots of ideas, lots of little actions. We need to work out how we're cooking the fish and chips because they're soggy. But this deep dive information has provided us with an absolute wealth of information to look at very local improvement projects that will improve patient experience, but also things that we can do trust-wide. The staff, the commitment of the staff was just absolutely immense. Everybody was in the command centre. We got some of our Stexo team, the people who pick the food to make sure there's the right items on the trolley for delivery. We got them into the room. We used it as student spoke placements, and everybody just collaboratively working together. We got some extremely positive comments from all areas, one from a student nurse there. So for us, I suppose, once we'd done it, what was next? Well, we've done a detailed analysis, and we've got a few copies of the report that we've done out on the stand, which shows all the data, but it was about the dissemination of the results. Dissemination of the results at that sort of hospital divisional and real local level, and then people could have the data back, and we were very keen and made sure that everybody had the data back within 2 weeks. It took us somewhat longer to write the report, and then they could develop those local work streams. As I mentioned before, we've identified 10 trust-wide high-impact actions. One, of course, is protected meal times. Another was introducing a housekeeper meeting to bring all our housekeepers together for networking. we continue to seek regular patient feedback and always aim for excellence. And I suppose at the end of it, once we've taken our breath, was once we've given the local teams time for improvement projects, and we undertake the 10 high impact actions. Do we do it all again next year? And that's the end of the presentation.